Good morning, students. Today's class we will see about communication. In communication, today we are going to see about definition, its purposes, modes, elements, process, and factors affecting communications and levels of communication. So we will see one by one. Communication. Communication is a dynamic, reciprocal process of sending and receiving messages. Communication is more than an act of talking and listening. From the first cry of the newborn to a whisper of a person who is dying, the primary purpose of communication is to share information and to obtain response. People use communication to meet their physical, psychological, emotional, and spiritual needs. So, communication its meaning depends on the setting and context of its use. Basically, however, it is necessary component in human relationship and therefore means or use through thought information exchange between or among two or more people or intrapersonally. That means self-talk. We talk to ourselves. So definition. Communication is any act by which one person gives or receives from a person information about a person's need, desires, perception, knowledge or affective states. Communication may be intentional or unintentional, may involve conventional or unconventional signals, may take linguistic or non-linguistic forms and may occur through spoken or other modes. So it's an exchange of information. What we want to tell to someone else, we'll exchange it. And it's a vital part of everyday life. Not only in nursing, in every part of our life, communication plays a major role. So next is the purpose of communication. Mainly there are four purposes. First is to inquire. Second is to inform. Then persuade and to develop a rapport. These are the four main functions of communication. Then the goals of communication include to obtain useful information, facilitate patient understanding, provide information and problem-solving skills, encourage acceptance of responsibility, foster independence, relieve stress, develop trust. And communication in nursing. Nurse communicate when assessing the patient need, planning the care, implementing the care, and also evaluating the care. Modes of communication. The three main ways or otherwise known as modes of communication. They are verbal, non-verbal, and electronic methods. Verbal communications are the both spoken and written words. Type of words, tone of voice, speed, written words and meaning they convey, timing and clarity of the message. Second is non-verbal by body language, facial expressions, appearance, posture, gait. Gait means the way how we walk, gestures, nods, etc. For the gait, you may have a doubts because if some injury on your leg, you may not be able to walk properly. So it gives a non-verbal communication to the others that you have an injury of your leg, so you means you won't be able to walk properly. While walking, you have pain. Then electronic communications include computer like email, SMS. All this comes as the electronic communication. So elements of communication. According to Berlow, there are four elements. They are the source. S means the source, that is the sender. Otherwise we call it as the encoder. The person who initiates conversation or sending the message. M for message. It consists of the verbal or non-verbal information, whatever we want to communicate to others. Second is channel, the medium through which we convey the message. And receiver, the person who receives, listens, observes or who interprets the message. So these are the four elements of any communication. So they should have a source, should have a message, a channel and a receiver. And process of communication. The effective communication involves either a personal, that means the face-to-face communication, or some means of encounter that require the following four necessary components like sender, message, receiver, and response. Sender may be one, two or a group of people with a message to send, convey. Message, that means the information which we want to convey. Receiver is the person who listens. The response is the feedback which we get from the receiver. Factors that influence communications include, first one is process of communication, their perception, attitudes, relationship, values, roles, development, gender, and the space. So the level of development helps in modifying both message and response. For example, a message to an astronaut requires modification if sent to either a love person or a 10-year-old child, because astronaut is a person who is expert in some particular terms, but it may not be familiar with a love person or a 10-year-old child maybe to speak to them. Then gender, males and females develop differently and so have some difference in communicate even in adulthood. Values, the standards that the personal, communal or society that influence the behavior. Therefore, personal value traits and experience do influence the perception of communication and behaviors of others as well as response to them. Perception. Perception is a personal view of any situation which in effect influence the perception and response to events. Then attitude of caring, concern, interest, etc. are portrayed and or betrayed by either good or bad mood. Example, when an elder speaks knowingly or unknowingly and believing that conveying caring, but a patient sees it as a demeaning and patronizing. Caring, warmth, respect and acceptance. Then personal space. When we speak to a person, it's an intimate space, that means between 1 to 1.5 feet. It is characterized by intimate body contact. Then personal space 1 to 1.5 to 4 feet. Characterized by more space, less overwhelming with moderate. Social distance by 4 to 12 feet. And public distance 12 to 15 feet. It requires careful pronunciation, louder tone of voice and clear clarity. And territoriality, also about the space, a domain that concerns a person, that is a kind room, a space around a bed and demarcating curtain. Role, student, teacher, father or mother, son, daughter, roles, etc. Relationship is a similar role as the teacher-student relationship. Then environment, it's a comfortable surrounding with a noise-free or with a noise environment. Congruence, it refers to compatibility of verbal and nonverbal messages, that they both match, not saying giving two more different messages. Use of communication. Communication is used to get response, influence or to obtain information. And there is another term known as therapeutic communication. Therapeutic communication helps to promoting understanding and constructive relationship, understanding of both content and feeling expressed by responding. Attentive listening. It's an active listening about giving an impressions of either selective listening or not listening. The message is not all important to you, or you are in a hurry and would rather somewhere else also. Physical attending. It portrays a physical presence with full attention span and interest. Next is levels of communication. There is intrapersonal communication. It is a powerful form of communication that occurs within the individual. This level is almost a self-talk. It's also called a self-talk, self-verbalization or inner thought. People's thoughts strongly influence perceptions, feelings, behavior and self-concept. Second is interpersonal communication. It is one-on-one interaction between two people face to face. It is the level most frequently used in nursing situations and lies in the heart of nursing practice. It takes place in the societal context and includes all symbols and cues used to give and receive meaning. Transpersonal communication, it is the interaction that occurs within the person's spiritual domain. Study of influence of religion and spirituality has increased dramatically in recent years, and ongoing research will help to understand the role of nurse in addressing patients' spiritual needs. Small group communication. It is an interaction that occurs when a small number of persons meet. This type of communication is usually goal-directed and requires an understanding of group dynamics. Public communication. It is the interaction with audience. This is an opportunity to speak with a group consumers about health-related topics, present scholarly work to colleagues at conferences. Types of communication. First one is formal communication, a conversation between officials on various positions. That means between nursing superintendent and staff nurses. Informal communication, conversation between people like non-official matters, example interaction between two close friends. One-way communication always flows in one directions and no feedback. Example, lecture delivered by a teacher in a classroom. Two-way communication, in a conversation, feedback is present. Visual communication, message conveyed by using symbols, example, displayed posters or models. Telecommunication, communicating with distant places with use of electromagnetic appliances like television, radio, internet. Thank you for listening.